Ligament pain in pregnancy. I know a lot of times we'll just go, oh, that's ligament pain, but I really want you to understand why it's ligament pain, and we're going to talk about some of the ways that you can prevent it from happening. I gotta say, this was one of the most often things I talked about as a triage nurse in labor and delivery. People would come in with burning pain that would just happen every once in a while, thinking that it was contractions, when in reality it was this ligament pain. And I want to save you from a trip to labor and delivery. That's right. This video is going to save you a trip to labor and delivery plus a copay. So it's pretty much priceless. So stay tuned. Of course, when you're learning about the pains of pregnancy, you can really get in trouble when you don't understand when it's a problem versus something that's a little bit more normal or how to fix it. So make sure that you're learning from an expert. Hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. And I think understanding why pains are happening really helps us to lessen them. And I am here to lessen your pain during pregnancy. So let's get started. Okay, so what are the round ligaments? Here's your uterus, my friends, and the round ligaments sort of attach the uterus to the sides of your body. So most often you'll feel the ligament pains sort of up here, kind of along the spine, and then they also attach into your pelvis. So there's round ligaments going all along the pelvis, sort of out like a fan, where it just attaches it to your body. Now, ligaments are sort of like a little rubber band, and as they stretch, that's exactly how it feels, right? Something's getting stretched, it burns. That's how a ligament works. Now here, I want to give you a pro tip. I think any pain that's really affecting your life is worth a conversation with your provider. So I would recommend, if you're having pains like this, definitely talk about it at your next prenatal appointment. But today, I just want to give you some basic information so that you know either what a pain was or what to expect in the future. So what does round ligament pain feel like? In general, it feels like you're being stabbed. It's very sharp, burning. Ligament pain might hurt for 3 to 5 minutes versus a contraction that usually only hurts for about a minute, sometimes only 30 seconds. Whereas ligament pain is stabbing pain that happens and it just stays there. And normally it happens up towards the sides and down into your pelvis. So instead of like where your uterus is, it's more on the outskirts of that. Okay, so when do people most often feel this pain? Well, it's usually when your uterus is growing. So a lot of times I hear people talking about the ligament pain even early in pregnancy as the uterus is just starting to grow. You got to remember that your uterus starts out smaller than your fist and then is going to grow to fit a baby plus amniotic fluid and a placenta inside of it. So as it's starting to grow, even early in pregnancy, this can cause ligament pain because, as you can imagine, these bands that are stretching to the side of your body as your uterus enlarged can really be stretched, causing you pain. So what can we do about this ligament pain? Well, the first one is to sort of prevent why they're happening in the first place. A lot of times people feel ligament pain when they cough. Shout out to all my moms out there who have a cold or flu, absolutely miserable. Or sneeze or laugh really hard. Now, if you're doing that, I recommend getting a pillow and sort of splinting it on your belly to help your uterus not just explode and then starting that ligament pain. So you're just going to take a pillow, probably smaller than this one, and just push it against your belly while you're coughing. In fact, this is a pro tip for people who've had a C-section. We ask people who've had a C-section to do the same thing if they're coughing or laughing. Another time people feel ligament pain is if they get up really quickly. So let's say you're laying down on your bed or the couch and you sit directly up. A lot of times your ligaments will be like, what the heck? Really upset. Let's stretch and get mad at her, which of course results in the pain. So when you either turn to your side or get up slowly or get an assist to stand up, that can really help the ligament pain from rearing its ugly head. As a note, these ligaments are meant to stretch. However, it's the quick movements that really get them out of sorts, and that's when they hurt more. One thing that a lot of people find that helps them out is using heating pads. Now, you do not want to use a heating pad or a microwavable heating pack, which is actually my favorite because a lot of times you'll fall asleep. And if you just use the microwavable heating pad, then it cools down as you're falling asleep. But you just want to use them like on the side. So if it hurts up here, you can put a microwavable heating pad just on the side. You just want to be sure we're not going directly over your belly. If you have any questions about using a heating pad in pregnancy, please talk with your provider. The other thing is you really have to relax, which is the worst. Like, your body is stabbing you. Your natural reaction is not going to be like, oh, this is so great, let's relax. Of course, it's going to be to tense up, which makes your ligaments even more upset. So the more you can relax, great time to practice that labor breathing, the more they're going to resolve quickly. Now, if you're having these types of pain frequently, I totally recommend talking with a physical therapist. Like I said before, I gave you a couple things that you can do to change your mobility patterns to help with the ligament pain. However, a physical therapist, that's their job, is to give you mobility training to really make your life a little bit more successful and less painful. Plus, they might be able to even help with pelvic floor things, and I think it is always a big win to make a relationship with a physical therapist before you have your baby, because there's a good chance you're going to want to visit them after you have your baby. So talk with your provider, ask them if they think physical therapy would be helpful for you. As a reminder, your provider is not a mobility training specialist. That's why we have physical therapists. So if they, at your appointment, just say, oh, this pain is normal, that's when you say, it is really affecting my day-to-day. Is there someone I could see, like a physical therapist or a chiropractor, that could help me out with this, and see what your provider has for your area. Now, as I said, a lot of people come into the hospital thinking they are having contraction pain when in reality it is ligament pain. Contraction pain should come every 3 to 5 minutes. So you're feeling it goes away for 4 minutes, and then you're feeling it again. Whereas ligament pain will be a stabbing pain that maybe happens in quick succession and then slowly goes away. So that's an easy way to tell ligament pain from contraction pain. But of course, if you ever have a question, you can always go into labor and delivery. As a reminder, they're open 365 days a year, 366 on leap year, 24/7. So you can always find help in labor and delivery, or call your provider. A lot of them have somebody on 24/7 that can answer questions for you. Okay, I hope you guys found this video helpful. I really am here to help you understand the pains of pregnancy and maybe mitigate them as you can. We are really trying to grow our channel right now, and every time you guys give these videos a thumbs up, it really helps our channel grow, and we really appreciate it. And give me a follow so we can hang out for the rest of your pregnancy.